AM Best has revised its outlook on the U.S. health insurance segment to negative. Here to discuss the factors behind the change are Jennifer Asamoah, Senior Financial Analyst, and Bridget Maehr, Director. And Jennifer, starting with you, the report highlights higher medical expenditures across the board. What are we seeing there?
Well, it's true. The U.S. industry is experiencing a broader base increase in medical and pharmacy expenses. Although it varies by line of business, majority of the segment are reporting elevation in trends driven by higher utilization of specialty drugs. There's also a significant uptick in GLP-1s. The industry also reported an increase in physician visits, inpatient admissions, as well as ER visit. The industry as a whole also reported an increase in behavioral health claims, as well as increase in coding intensity, which is reflected in member acuity for managed Medicaid members. The trend seems to increase in the later part of 2024, with underwriting earnings declining materially through the end of the year. The industry also entered into 2025 with higher than expected medical and pharmacy expenses or trends. In the first quarter of 2025, the industry reported elevation in respiratory claims driven by flu, COVID, and pneumonia.
You mentioned GLP-1s. Mm-hmm. How are insurers responding to the increased use of these drugs?
So the industry has seen a rapid rise in GLP-1 usage, and they've changed the coverage for 2025, which is driven by a couple of things. There's been an increase in member usage of GLP-1s, and there's also prescriptions have also increased for it. But both health plans and employer groups are changing the coverage for GLP-1s for 2025 and only covering the drug other than for weight loss.
Bridget, one of the themes that keeps coming up is the deterioration of risk pools. Can you explain the dynamic behind that?
This is mainly being seen in the Medicaid and the Individual Affordable Care Act marketplace business. In Medicaid, the risk pool has shifted considerably. During the public health emergency, which was enacted due to the COVID pandemic, states were not allowed to disenroll Medicaid members. During this time, the Medicaid enrollment increased as people lost employer coverage or became eligible for Medicaid based on lower wages. The completion of the eligibility redeterminations saw Medicaid enrollment drop significantly. Since states couldn't disenroll anybody for any reason, there were individuals that could have had coverage elsewhere and were not using their Medicaid benefits. So the Medicaid risk pool deteriorated as the non or low utilizers were disenrolled, and the acuity of the remaining population on average was higher. In the individual marketplace, there was an increase in enrollment during the same time frame as some of the individuals who lost their Medicaid coverage based on earnings became eligible for subsidies in the marketplace. And this negatively impacts the risk pools for the individual marketplace population, because the Medicaid eligible individuals, the people who came over, typically are higher utilizers of medical services. Now, since all rates are determined based on historical claims data, it will take time for rates to match the current Medicaid and individual populations based off of the risk profile, as well as the current medical trends that Jennifer just discussed.
So AM Best sees these pressures persisting into 2027. What will insurers be doing between now and then to be ready for this?
Pricing and plan design will be key for plans to be able to manage through this period. Additionally, plans are looking at their administrative cost structure, care management to address the increased morbidity of their members, and will continue to emphasize value-based care and strategic provider relationships to manage medical costs. Additionally, we expect that some will decide to exit or the market segment or specific geographies for Medicare Advantage or for the marketplace offerings. And then Medicaid is also facing funding cuts in the future, mainly through the addition of work requirements for certain eligible individuals and increasing the frequency of redeterminations. These are two things that are going to be put in place that were enacted through the One Big Beautiful Bill. The plans are going to need to build the administrative infrastructure to support these changes.
Bridget, Jennifer, thank you so much for taking the time to speak with us today.
Thank you.
Thank you.
That was Jennifer Asamoah, Senior Financial Analyst, and Bridget Maehr, Director. You can find the full report online at ambest.com. For AM Best TV, I'm John Weber.